Okay. Hello and welcome. We're providing this training to give you the background you will need to assist with this incident. You are here because you have volunteered to staff a point-of dispensing site due to an emergency event. A pod is a site where medications or vaccines intended to prevent disease or exposure may be given quickly to a large number of people in the event of a public health emergency. The medications come from the Strategic National Stockpile, or SNS, which is a large stockpile of medicine and medical supplies to protect the American public if there is a public health emergency severe enough to cause local supplies to run out. The medications that will be dispensed at the clinic are doxycycline, ciprofloxacin, and amoxicillin. It is important to know the layout of the facility where you are working. Refer to the map that identifies building entrances, rooms, and exits. The pathway that people are directed to follow, also known as the pod flow, plus the location of the stations, is clearly marked on your map. For pod flow, the names of the station found at this pod include greeting, screening, dispensing, and exit. The functions of each station are as follows: greeting, registration, triage, and forms distribution. People entering the pod will be greeted and given a registration form to complete. All people entering the pod will be given all forms and any instruction and/or assistance necessary to fill them out. Forms review and patient education. Staff review forms to determine suitability of medications the people are about to receive. Staff will hand out patient education materials, medical information handouts, agent or incident information as applicable, adverse event reporting instructions, and other materials to patients. Dispensing. Medications will be dispensed. Once they receive their medications, they will proceed to the exit through the exit doors. Additional stations at the pod. It is also important to know where break rooms and restrooms are located. Remember, breaks are mandatory and they're a time for you to relax and de-stress so you can function at an optimal level. Please look over your handouts or maps to learn the station names, where they're located, and what's done there. Remember that confidentiality of records and personal information needs to be maintained throughout the pod. Make sure you know who is in charge of your station. This is the same person you report to and go to with questions. Once at your station, don't forget to take breaks as scheduled, ask questions as needed, and paperwork has to be completed. All forms you're responsible for completing should be listed on your job action sheet. Make sure you know to whom your completed forms should be given, what documentation needs to be turned over to the next shift. Lastly, your supervisor will make sure you know the location of necessary resources and supplies and how to obtain resupply of these resources. Please just don't go get more without permission or authorization. Resources include items such as needed supplies, required forms, and the medication you will be dispensing. Thank you for your time and talents to assist with this exercise. Remember, the overall goal of this pod is to provide medication to a large number of people in a very short time. This can be a stressful or confusing time for many, so part of your job will be to be helpful and friendly to everyone as they proceed through the pod. If at any time you have any questions or need any assistance, please do not hesitate to ask. Thank you for watching this introduction to pod exercise video.